Hello, I'm Adam Jones, and this is the Module 1 Other Research Methods presentation. I was in Group 3 and was given program evaluation to research, and the following is the data that I found. So, program evaluation was actually developed as a way to look at various medical programs and medical research and to deem those particular programs as being successful or unsuccessful. And a lot of the information that I found was actually given from the Centers for Disease Control. And as you can see below, the CDC defines program evaluation as the systemic collection of information about the activities, characteristics, and outcomes of programs to make judgments about the program, to improve program effectiveness, and/or inform decisions about future program development. What that basically means, and what I saw throughout the research, is that it's easy to see the need for a program and to start a program. The real test comes when you have to involve other people, or as they call them, stakeholders in the program, and actually figure out whether or not the research deems the program is worthy and how to go back and fix any shortcomings that the program might have in order for it to continue. So the development or the history of program evaluation actually goes back to the 1960s, and this was actually found in a different source by Shek, Liang, and Lin. It was a research book that actually looks more into the education side of it, but they provided the history of it. It started back in the 1960s, and it was used more as a qualitative research method, and it really still is now more than anything, because you're really having to dive in with those stakeholders to find out how effective the program actually is. It continued to evolve, in the 1970s, and then continued on through the 1990s as a way to really deem whether a program is a success or not. And they started to have a lot of different assessments in order to make sure that there was a way to measure the effectiveness of the program. As it continued on, and actually where we kind of are now with program evaluation, is that a lot of the evaluation standards are actually set before the program actually begins, and those standards are actually looked at as the program goes along, and the program is actually judged against those standards instead of actually assessing the program after it has begun. So as we go forward, there are 6 steps of program evaluation, and these were found on the CDC website as well. You can see them below. They're all very, very important as far as where you start and where you end with program evaluation. What we're going to find out is that really the number one thing, the most important thing in program evaluation is actually the stakeholders and the involvement that they have in order to take the program as they go through it and deem it worthy and successful, and then take the data that was collected during that time and see whatever modifications needed to be made in order for that program to be successful. So what we'll do is we'll look through each one of these 6 steps as we go through the different stages of program evaluation. So the first stage, or the first step, is to engage the stakeholders. And the way that you have to engage those stakeholders is you have to identify them, you have to be able to review the information and review what kind of development is actually occurring in the program, and then finally engage those stakeholders in order for the program to be deemed a success or a failure. Stakeholders could be anybody. Again, with the CDC deeming this as more of a medical approach, we're talking about people in some kind of study, or people who need medical care that might be part of a group as far as either delivering medicines or having people travel to the hospital, just basically finding out which is the most effective way to carry out a program. If we're talking about it in terms of education, it's those students, the community members, the teachers, and everybody involved in the educational system that have to be involved in order for a program to work, and all those people have to be on the same page in order for that program to get started. So once the stakeholders are engaged, you move on into the next step, in which the program is actually described. And it could be any sort of program that may be started or is going on in a school. Again, through the CDC format, it was described as maybe a medicine or a prescription delivery program or a patient transport program in order to get patients to and from the hospital for treatments. So you can see as we describe the program, we talk about what it's all the different aspects that are needed for the program to work. And it's through those needs and those resources that are brought together that we're finally able to determine the outcomes of whether or not the program was actually successful or not. If we're talking about it in terms of education, it would be everybody looking at what the program needs to be successful, what resources need to be brought in for it to continue, and then finally what actually happened once all those resources were brought in that actually made the program work or not work. The next step is going to be to focus the evaluation design. In other words, we have to figure out exactly who is the most affected by the program. And then basically what sort of resources or what kind of time must be allocated for the program to be successful. This is where the utility versus feasibility argument comes in. Is the program a feasible thing where it's not taking so much time and a lot of resources where a lot of people have to be committed to a singular focus, or is it something that can be done and built upon in order to make more and more programs successful or to make more schools successful? Finally, once all the information and all the data is finally be able to be presented, you have to gather that data in order to find out whether or not the outcomes that you wanted for the program were successful or not. There's all different kind of ways to collect data, whether it's not necessarily a quantitative versus a qualitative measure with program evaluation. A lot of it is going to be qualitative data where you're actually having to talk with the stakeholders and interview stakeholders, survey stakeholders, where that information is going to have to be gathered in order to find out what everybody feels about the program, how they feel it's being successful or unsuccessful, and then be able to determine what modifications need to be made in order to make the system or the program better. What we find is that a mixed method approach is actually more appropriate for this kind of research with program evaluation, just because, yes, you are able to gather some hard data and some hard figures to help justify the program, or if there's an issue with the program. But in the end, the qualitative part where you're interviewing the stakeholders and the stakeholders feel like they have a stake in the program is where the ultimate success of the program actually occurs. Finally, it's the justification of the conclusions. Once the data is gathered and once you find out the outcomes of your program, you have to be able to justify whether or not the program at its core was a success or not. And then if there were issues with the program, are there modifications that can be made in order for the program to actually be more successful in the beginning? Was the data that you produced show any biases? Were there any sort of limitations? Did something come up during the process of developing the program that needs to be changed going forward in order to make it more and more successful? The very final step is to make sure that you ensure the use of evaluation findings and you share the lessons learned. This is where the stakeholders have to absolutely be involved in the continual growth and development of this program. They have to have a voice in order for the program to continue to be successful. The data has been found, the modifications have been made, and people find the program successful, but there still has to be a voice from the stakeholders in order for a buy-in to continue to happen in the particular program that you have. So there's some appropriate and some inappropriate uses for this particular kind of research, this program evaluation research. Obviously appropriate, we mentioned that it has to be a mixed method approach. It can't just be strictly quantitative where you're looking at hard data, because those researchers have to be interviewed and talked to, and they have to be able to provide their opinions about what they deem worthy or unworthy in this particular program. As we go through the program evaluation, the ultimate success or failure of that particular program is coming straight from the stakeholders. And so a quantitative only approach does not work. You have to have that qualitative aspect of it in order for them to provide that input. You also have to have a broad overview or a broad amount of input. It can't just be one singular person, one singular administrator saying or deeming a program worthy or unworthy. It has to be a large gathering of the various stakeholders that deem it a success or a failure. As we look at it in more of a light of education, Sheck, Liang, and Lin in their research defined a program evaluation as it refers to the systemic, scientific, and rigorous investigation of a program's effectiveness. When we talk about a program in education, it could be anything from the development of a new class to some sort of extracurricular activity to a community service project, community involvement, trying to get people more involved, the community more involved in the school. And we'll look at a couple of examples as we continue on during the presentation. For example, one example that I actually saw firsthand was the town that I live in. They were proposing the implementation of a new UIL sport, in this case baseball, at the high school level. The school did not actually play baseball, but there was enough community interest that the school began to look into what it would take to actually bring a baseball team into a UIL sanctioned sport. The first thing that had to be done was it had to be presented to the community. Most of the community was on board. However, there was several community members that had a lot of concerns, and the most important thing through this program evaluation is to make sure that both sides were heard, the ones who were for and against it. Some of the other things that were brought up were things like Title IX compliance and various kind of government kind of things that had to be monitored in order for the program to actually be implemented. And what ended up happening is that they found out that they were already being grandfathered in on their Title IX compliance and actually had to begin with a softball program. And so they tied the success of a softball program into the formation of a baseball program. And it actually is in its beginning stages right now. And the softball program is actually showing signs of success, which is something that in the beginning a lot of people were very skeptical of. There have been modifications that have been made. Several members of the community have actually asked to make the program or stop the formation of a baseball program, but maintain the continuation of maintain the continuation of the softball program because it's actually showing success. And this is where the stakeholders get involved. They get to have an opinion, and then the modifications can be made in order to make sure that the program is more and more successful. Program evaluation is a very, very large research area. It involves a lot of different aspects and has a lot of different reaches. Like I said, it did begin in the medical field, but there are some aspects to program evaluation that actually work very well in the field of education. I hope you found this particular presentation insightful, and I appreciate your time. Thank you very much.